Hello, how are you? I'm Sebastian again. I'm going to talk about now basic life support and resuscitation. This presentation is how to approach the outpatient management with a very important emergency that is the sudden cardiac arrest, okay, the cardiorespiratory arrest. And all of the cardiorespiratory arrests can occur or in the hospital or outside the hospital. So this presentation is only to know how to manage this when you saw this outside the hospital. I'm going to talk about a little about all the guidelines of the basic life supports guides. There are international guides that have a very high quality information and that are from an international organization called the AHA, American Heart Association. So let's start. So we're going to look in this presentation the route, that is how to recognize a cardiorespiratory arrest. That is an error, it was a mistake. How to recognize a cardiorespiratory arrest, like the clinic, the symptoms and signs. We're going to talk a little bit about the BLS of basic life support of the AHA that I told you. How to perform a high quality cardiopulmonary resuscitation, when to do it, how to do it, and the most important, why we have to do it. The importance of the high quality CPR. And to explain the basic life support algorithm, pass by pass, step by step, how to act, what to do in each situation. We're going to talk a little about the AED, that then you will know what it is, and the Heimlich maneuver. We're going to see some interactive videos also, and I hope you enjoy this presentation. So first, what is a cardiorespiratory arrest? It's when the heart stops. Yes, it can have many different causes. Also, it have a lot of different presentations. You can see a patient that is only in the floor without responding. You can see a patient that is like with pain, and then the patient fall down. You can see a patient. It can happen during sleep. It can happen in any situation, in every place. Can be walking in the public place, in an hospital, in any place. The concept here is that this thing is very severe and needs fast action, because if you don't recognize it fast and you don't act, the patient die. Technically speaking, when you have a cardiac arrest, the patient is technically die. That's the reason why when you treat that, you say that you resuscitation of the patient. That means to make alive again, okay? Because the heart, it's like a pump. So all the symptoms that can occur are because of the failure of the pump. So here we have the pump. And this pump, when it is stopped, like when the heart stops, it stops circulating all the blood from all the body. So which are the manifestations of a cardiorespiratory arrest? All the things that can happen because of the lack of blood into all the organs. So here we have three important manifestations: the mental manifestations, the cardiac manifestation, or the respiratory manifestation. It can be replaced by neurologic manifestation. That is a more adequate word. So what you will see, you can see alteration of consciousness. You can see a patient that falls down and is not responding. You also can see a patient that is maybe respond a little bit, maybe is breathing, but is not well. The neurological status is not completely normal. Also, you can see the cardiac manifestation, that is the key to the diagnosis, is the absence of pulse. You have to check the pulse. You only have 10 seconds to check the pulse, and you must check it in the carotid area. That is a central pulse. Because if you check it here, for example, radial pulse, that is a peripheric pulse. Maybe you cannot feel it, but the pulse is present. So you need to check central pulse, like the carotidial pulse. And you have to do it in 10 seconds with 2 or 3 fingers. It cannot be the thumb. This finger cannot be, because if you do it with that finger, you can feel your own pulse of the arteries of your finger. But if you do it with these 2 fingers or 3 fingers, it is okay. So checking of pulse must be in 10 seconds, and if the patient hasn't pulsed in 10 seconds, immediately you must start the CPR. In every minute that pass without doing the CPR, the survival falls at 10%. So in 10 minutes, it means that you are dead. And the last manifestation is the respiratory manifestation, that the patient can be no breathing or maybe gasping or having some difficulty with the breathing. So all of that three manifestations are the manifestation of a cardiorespiratory arrest. So what happened with the cardiorespiratory arrest? The cardiorespiratory arrest is a very sudden, very surprising situation, and also a very severe situation. So it was very difficult years ago to make studies about how to treat the cardiorespiratory arrest. There was no evidence, because you cannot start a study with someone who is almost dying and you need to act. So it was very difficult. But after a few years, like 10 years ago, some organizations start to study this, and they put together all the evidence, and year by year they go actualizing the evidence in order to have a unification of the management of the cardiorespiratory arrest. Because 40 years ago, all the people treat the cardiorespiratory arrest in different ways or manners, and now all the evidence, it was put together. And who is the organization that have studied more about this and is the most recognized all around the world? Is the American Heart Association. So this association give all the recommendations and the guidelines, and also train the personnel, the health personnel, to do this. The American Heart Association have two different manuals to provide teaching about how to resuscitate, and one is the BLS, that means Basic Life Support, and the other one is ACLS, that means Advanced Cardiovascular Life Support. This class is going to be about basic life support, that talk about how to manage a patient in a non-hospital scenario, or it can be in a hospital but in the ground, not as a patient. The simple management, and is without all the materials of the hospital. It's only with your hands and with some things that you have to learn and to ask. But the ACLS is in a hospital setting with a resuscitation trolley, drugs, vasoactive drugs, manual defibrillator, also intubation, and a lot of different things. So it's more complex, and it must be taught by a presential class with the materials, with simulation. But the BLS, it's easier to teach by online classes. So as I said we're going to talk about the BLS. The BLS is a course that is done all around the world in different languages, and for all the healthcare providers. And it's a minimum of knowledge that all the Ministry of Health of every country want from all the health installations. It's like a guarantee to have an accreditation of the institution. And in summary, the fundamental aspects of the BLS are these points, these 4 points. And I think all the class can be summarized in this. This is the most important. So, immediate recognition of sudden cardiac arrest, that is the first point. Activation of the emergency response system, that is to ask for help. Early CPR and high quality CPR. I must change this, and high quality CPR. And rapid defibrillation with an AED, that is an automatic external defibrillation. We're going to talk about this point by point. First, I want to show you this is the algorithm that guides us how to act in the BLS. The algorithms are tools that facilitate you everything, because you don't have to memorize it. You can have it printed, you can have it in your wallet, or maybe you can memorize only the first part, but the other part you can read it. But they can help you whenever you need it, and they can conduct, and the way of acting, in this algorithm, all the information that is provided is based on scientific evidence and very important studies, and all of this is put together. So it's the easiest way to do the best thing and the most correct way. And this is written and prepared by the most qualified doctors all around the world in the topic. So we need to believe this. I present you here the surveillance chain, that is like a summary of the most important things that you need to do when you are in front of a sudden cardiac arrest. early recognition on call, early CPR, early defibrillation, and early advanced care. So here to make a break, I want to say to you, this is a Chilean cultural break. This, I don't know if you know who is this person, but this is Alexis Sanchez. As you know, I am from Chile, and my country produces and exports a lot of different good football players, and this is one of them. This photo is when he was on Manchester United, because I made this presentation a few months ago, but now he is in Milan, in Inter de Milan, that is in Italy. So now you wouldn't see him in the Premier League, and he didn't do it very good. In Arsenal he did it a little good, but here in Manchester he didn't do it very good. So it's good that he go away and now he's in Milan. I hope he is going to rise up again. So I have a question for you, and it's this question. Does someone know the emergency number of Kenya? So put on the situation that you're in Mbaghati going out because you end your job and you're almost to take the matatu, and you saw someone suddenly fall down. You go to check it, he's unconsciousness, doesn't respond. You check the pulse, there is no pulse. So you start doing the CPR, but you ask someone to call for help. Which number you have to call? It's very important, that question, because if you don't know this question now, while I'm asking you, it means that if you are in front of an emergency, you also won't know it. So now, in this moment, I want you to search the numbers of the ambulances that you know in Nairobi and save it in your phone. So in the situation that you need to call some ambulance, you can call it very fast. Okay? The numbers in Nairobi is the 999 or also the 122. Those two numbers, if you call, you can have a response of an ambulance. Also, if you are very near Mbaghati, you can call someone and bring the patient to Mbaghati. But the concept here is to be prepared, to have the number before, because this can happen in any moment, in any situation, so it's very important. And also, if you change of place, you go to work to Turkana, you go to work to, I don't know, Tanzania, it's important to know, to have on your mind and in your phone, the number of emergency, so you can be able to call if you need the emergency in that moment. So this is the first part of the algorithm. So if you see an unresponsive patient or person without normal respirations and you see it on the floor, you call 911, that is not the number of Kenya, you call the number of Kenya, and ask someone to get an AED. So once the people are helping you doing that, you start this. You assess the pulse. Important, in 10 seconds, as I say to you. And if in 10 seconds there is no pulse, if in 10 seconds there is pulse but is no normal breathing, you give rescue ventilations. That is one breath every 5 to 6 seconds. And of course, you have to continue monitoring the pulse every 2 minutes. Okay? By the other way, if there is no pulse, that is this part of the algorithm, if there is no pulse, you start cycles of 30 compressions and 2 breaths. And when you complete 4 of that cycles, that means 2 minutes, you check the pulse again. So you continue checking the pulse every 2 minutes. But if before completing this cycle you get the defibrillator, in the moment you get the defibrillator, you need to make a monitorization of the rhythm, a verification of the rhythm. So if the rhythm is shockable, the defibrillator is going to say to you what to do, and is going to give a shock. If the rhythm is not shockable, the defibrillator is going to say to you, continue the CPR. Okay? So once the defibrillator arrives, the defibrillator, the machine, is the chief, and you have to obey the chief. He will mark you the time to do the CPR, he will do everything. But on the previous time, when the defibrillator is not here, you have to repeat the cycle all the time and verify if the rhythm is good, verify if the pulse is present or not. So now I'm going to talk a little bit about high quality CPR. What is the high quality CPR? It's the cardiopulmonary resuscitation that is performed in a good way. in a good manner, in the best quality as possible. And to be like that, you need to fulfill 6 criteria. And if you fulfill those six criteria, it means that your CPR is of a high quality and is well done. So the criteria are the following. Frequency between 100 and 120 per minute. The depth of the thoracic compressions must be 5 cm or 1/3 of the anteroposterior diameter of the thorax cavity. Also allow complete chest recoil, where this is very important. We're going to talk about this sooner in a few slides. Rotate every 2 minutes the operator who is making the compressions, because this is a very extenuating exercise. So if you continue more than 2 minutes, you will do it bad because you will be very tired. Avoid or minimize the breaks, because also we're going to explain this, but it's because the coronary perfusion, if you stop doing the CPR, if you stop 2 minutes, you will lose a lot of time, because to reach again the correct coronary perfusion, you need to be doing a lot of time the CPR. So when you stop, you have to start again. And the relationship between compression and ventilation is 30 every 2. So you do 30 compressions, you have to count, and after that you give 2 ventilations. Then 30 compressions, after that 2 ventilations. In children it's the same, but it's 15 against 2. And this is the correct position. The correct position must be with extended arms, because here the force is made by your body. The weight of your body is making the force down. If you flex your arms like this, you will doing the force only with your arm, and you will get fatigued soon. So the correct position is like that: straight arms, straight back, and the compressions must be here, located in between the 2 nipples. That is the highest, the place of the position between the 2 nipples, and the body is going to make the force, not the arms. Now we're going to watch a video about the CPR.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA-4CPR or visit heart.org/hands-only-CPR.
Okay, so after reading this video, I'm going to explain a little bit why is very important the CPR. Why is important to perform a CPR and as soon as possible. This is the heart. Here we have the coronary arteries. So the flow of the heart when it's working, like the pump, come through here, yes? You see the arrow? Come through here, the aorta, and go to all the body. In this, the ones that go here are going to the brain. That is a secondly most important organ with the heart. So the normal flow of this pump to work is 5 liters per minute. 5 liters every minute. That is the normal. With that, a normal human being can be alive. When a cardiorespiratory arrest occurs, this turns to 0. There's no blood flowing. So that means there is no blood supply for any part of the body. There is no oxygen for the brain. There is no oxygen for the own heart. So the pump is not working. So the brain doesn't have oxygen, and the heart also doesn't have oxygen. The CPR is very important because when you do the CPR, you imitate the function of the heart. You compress the heart, yes, with your own hands from the exterior, but you compress it. So now the pump is working, not too good, but it's working a little bit. So you can have like between 1 or 2 liters per minute. Okay? This is number 1. Sorry, it's a very bad number, but it's a number 1. So you have 1 liter per minute flowing. And what happened? When the blood is flowing here, in every beat, the blood flows, and then in the process of relaxation of the heart, the blood reflows and go from the coronary arteries. So in the moment of diastole, that is the moment when the heart is relaxed, the blood is flowing through the coronary arteries. That is the importance why you need to allow the complete chest recoil that we saw. That is one of the qualities, one of the criteria to have a high quality CPR. Okay, so allow complete chest recoil is a very important concept. So when you do the CPR and you allow to have this 1 liter of blood flowing, you increase the chance of the heart to start again beating by themselves, and also you increase the chance to have brain survival. Why? Because every minute that is going on without oxygen, it's a minute that the neurons of the brain are dying. So if you do the CPR and then in the future we can resuscitate this patient, if we have done the CPR correctly, we have more chance of prevent a brain infarct, a brain infarctation. So also the patient will have less disabilities. That is the reason why it's very important the CPR. Here we have a graphic about how is the survival between a patient without CPR and a patient with a normal average CPR and a patient with a high quality CPR. So in the first one, there is no CPR, so there is no anything flowing in the patient. Maybe it's a patient that have a sudden cardiac arrest in some place that no one was looking to him, so anyone can help him and he only continue without CPR. So the survival starts in 20%. After 9-10 minutes is 10%, and after 15 minutes it's almost 0, the survival. But if this person was, for example, in Uhuru Park and had the same problem, but some people that was walking over there knew about the CPR and start doing CPR, the survival falls more slowly. So at 10 minutes, the survival stays in 20%. At 15 minutes, the survival is a little less than 10%. So you have more chance. And in any of these moments, if you get an ambulance or a shock, the first shock with a defibrillator, you increases the chance. But what happens if this patient have this sudden cardiac arrest, but one of you that have made this course and know how to perform a high quality CPR, come to him. You start doing the high quality CPR, so the cardiac output that you perform is a little more, so you increase more the chance of survival until 40%, and after minutes is 30%, okay? And in 15 minutes, the survival is still in 20%. That is 1 of every 5 persons can survive. So here is the importance, in a graphic, the importance of a very high quality CPR. If you perform a good CPR, you increases the chances for survival. So I encourage you to learn very good how to perform a CPR, all the 6 criteria, and also it's going to be something that maybe I will ask in the final exam. Now we're going to talk a little bit about the ventilations. As we know, maybe this patient that is in the floor, we check the pulse and there it is, the pulse is present, but the patient is not breathing well. So what do we have to do? Is the ABC. First, open the airway to check if there is something and take it away. If there is nothing and is no pulse, you give 2 ventilations every 30 compressions. And if the pulse is present, you give 1 ventilation every 5 seconds. While you do the ventilations with your eyes, look the eyes of this patient, of this reanimator, you must be looking through the chest. You need look the chest if the chest is rising, when you are doing the CPR. So checks the thorax elevation, and every 2 minutes reevaluation if there is pulse or not. And how to open the airway? You need to perform 2 maneuvers that are called chin lift and jaw thrust. So you do that maneuvers and then you provide the ventilation with the open airway. These 2 maneuvers are the chin lift and the jaw thrust. This is the jaw thrust. It's like to open a drawer. To open a drawer, so you can move the tongue forwards in order to open the pharynx to allow and open the larynx to allow the air come inside the lungs. The other position is the sniffling position or chin lift, that you take the chin and lift a little bit. It's like a hyperextension of the head. This is forbidden to do when you have, for example, a car accident, because the patient can have injury in the spinal cord, in the bones, in the spinal bones. So you cannot do it. You only have to do this maneuver and perform the ventilations. But this maneuver is very useful, so you also can use it. If you want to learn more about it, you can search that link that I put in YouTube. So some of you know what is an AED, what means the acronym, or like maybe you know the acronym, but you know what it is, how to use it, or what it's for. Please put in pause the video and think a little bit. Now I'm going to show you the image of what is an AED. AED means automatic external defibrillator. It's a machine that helps you to make a defibrillation. That is like an electric shock very high to the heart that makes the heart start again. It's like a reset button. So this will help the heart to organize all the electric system to start again beating. But the defibrillation only works in some situations, in some kind of rhythms. For example, tachycardia ventricular tachycardia, or ventricular fibrillation. But there are some situations in which the defibrillator doesn't work. For example, non-electric activity without pulse, or electric activity without pulse, are different type of rhythms where the defibrillation doesn't work. So in the ACLS, the normal is to have a manual defibrillator where you check the rhythm with the defibrillator, and you have to interpret the rhythm in order to choose if you have to defibrillate or not. But here, this machine, that is a very good, interesting machine, check the rhythm by itself and automatically verify if the rhythm is shockable or is non-shockable. So the machine will say to you, and it's external because you put the patches outside in the skin. You don't have to do anything more, only to put the patches. So once this machine arrives, you're going to be doing the chest compressions or something. When this machine arrives, you have to use it in the same moment. You cannot wait to finish the cycle, to finish the 2 minutes. No, you have to use it in the same moment. So you put the 2 patches with the instructions that are here. One is in this part and the other in this part. Okay, so the electric shock can trespass the heart. And after you put the patches, you turn on the machine, and the machine will say you all the instructions. The machine will say you, so stay away from the patient, don't touch the patient, because I'm going to verify the rhythm. So it's going to verify the rhythm, and then it's going to say to you, rhythm is shockable. Please stay away from the patient. The shock will go in 4 seconds, for example. So then the machine will say, so press the button to give the shock. You press the button, all of you away from the patient, you cannot touch the patient. And then the machine will say, shock given, continue CPR. And the machine will say to you, will take you the time of the CPR, will give you the timing to make a correct frequency of the compressions. So the machine will help you a lot. But the moment before the machine, you have to be the boss and the chief of all the reanimation. When the machine arrives, the machine is the boss. So why is so important the defibrillation? Here I'm showing you a poster of a campaign that was made in Australia. In Australia, they had a lot of preventable death because of a non-managed cardiac arrests. And why? Because if you use it in the first minutes, increase the 70% of survival. If you use the AED in the first minute. And in the beginning of the arrest, sometimes there is only an electrical failure in the heart and not a mechanical failure, only electrical, like a short circuit. So if you provide the electric defibrillation, you can fix that electrical failure and the start of the beating again. But if you start with an electrical failure and you don't defibrillate in the first minutes, that electrical failure, because of the non-beating of the heart, can transform or can develop in a mechanical failure, where the cells of the heart, the myocytes, the muscle cells of the heart, is going to be damaged. So now this is not only an electrical failure, it's a mechanical failure. So if you fix it with the defibrillator, the heart will also have problems. That is the importance of the early defibrillation. So, for example, for every minute that passes without the defibrillation, the chance of survival falls 10%. So in 10 minutes, the heart cannot be revived. But if you give this in the first minute, there is a 7% of survival because in the first minute, it's only an electrical failure and not a mechanical failure. Not ischemia, nor not necrosis of the cells. But in this, after 10 minutes, all the cells are suffering a lot, so it's more difficult to make them awake again. Here is another Chilean cultural break. This is the Pine Towers, Torres del Paine in Spanish. It's a very beautiful place. It's like your Mount Kenya. I have been in Mount Kenya and it's almost the same, but I think this is more beautiful because it's from Chile. And this is the place when in 2014, I met Wenceslao, the other Chilean doctor that is working with me. And after that day, we are very friends. So this is a very important place, and I have a very good memories about this. Now, I'm going to show you only a little bit about the ACLS. The ACLS is the Advanced Cardiovascular Life Support. So it's another chapter that I invite you, if you have the money and the time, to do that course, because the formation that you win here is very useful. And here is the algorithm, how does it works. So I invite you to read it if you want and you have time. But this is a topic that is under the scope of this class, and I don't want you to learn this. I want you to learn all the other things, especially the characteristic of a high quality CPR, because also that is a part of this. If you can look here, is all the things that are the criteria for high quality CPR. So it's the same of my class, but here include drugs, for example, adrenaline, amiodarone, epinephrine, yes. And defibrillation, you have to interpret if you have asystolic or pulseless electrical activity, or if you have ventricular fibrillation or ventricular tachycardia. All of that things, you're going to learn it if you study the ACLS. So some special considerations in pregnancy. In a pregnant woman, the uterus is very big after the week 25, 20. So the uterus starts compressing the inferior vena cava. That is the reason why you have to make a lateral protraction of the uterus to prevent the vena cava compression, and that improves the preload, so improves the chance of resuscitation. So if you want to do the CPR, you do it in this way, in this direction, with the patient with a little tilt of 30 degrees. Other important considerations is that the compressions is the same technique than an adult, the same technique. The ventilations, you need a fast airway management because there is pressure from the abdomen that is increased because of the gravid uterus that increase the risk of aspiration of all the gastric secretions. So you need to manage the airway very fast and try to intubate as soon as possible, because when you intubate, you protect the airway from aspiration of food or anything. into the airway. IV line, it's preferable to put in superior extremities. That is very obvious. That is because if you put in the inferior extremities, because of the vena cava compression, the medication, the drugs that you will give or anything, or the volume that you will give, will not go to the heart directly. The defibrillation does not affect the fetus, so there is no importance about that. And the drugs that you use, you have to use the same drugs and doses than an adult. And there is no problem with the teratogenicity or the malformation, any of that, because you need to save the mother. Here the fetus is a second priority. But also there's no studies that demonstrate any problem with the teratogenicity, with amiodarone or adrenaline. So here there is another question, that when we have a pregnant woman, we have 2 lives to save, and when the life have viability after the 24 weeks or in Mbaghati after the 28 weeks, we need to know that also the fetus can live. So maybe if the mother is already dead, we need to think about doing a CS or something. So here it's a little algorithm about the conduct, or what do you have to do about the CS. So if the mother is less than 20 weeks, you have to continue a normal CPR like if there is no pregnancy, because the gravid uterus is not too much, so it doesn't affect the maternal hemodynamic, so there is no problem. Between 20 and 24 weeks, the uterus is a little more bigger, so all the cardiac output is going to the uterus. So maybe you can do a CS only if it's necessary to enhance the maternal hemodynamics. But this must be done by an expert, by a person that knows how to do a CS. It's not like an emergency measure that you have to do with a knife of the kitchen in some place. You need to do it in a correct way. If you are not available, you don't know how to do it, or you don't have the materials, you don't have to do it. And when there is more than 24 weeks, that there is fetal viability, you have to continue the CPR and the CS to save the mother and the fetus. That is not well written. To save the mother and the fetus, because if you do the CS, you enhance the cardiac output while taking away the uterus and the fetus, and also you save the fetus because the fetus is in a hypoxia system when the mother is shocked or the mother is with a CPR. If after 4 minutes of CPR the mother continues without pause, you have to perform a CS to save the baby, not to save the mother. So the decision of performing a CS here can be taken by any person after 4 minutes without pause. But this decision of perform the CS in order to improve the maternal hemodynamics must be taken from an expert and in a very specified environment. So this is the last part of the class, and it's another topic, but it's also a very important topic. So I want to start with this question. Does someone know the Heimlich maneuver? The Heimlich maneuver is a maneuver that we use to treat the person that have the airway obstructed by a foreign object. That can be a piece of meat, it can be like a toy, for example, a little boy or a patient that is mentally challenged can have something, can be eating something, a plastic thing, and can stop here. So the Heimlich maneuver is the maneuver that we use to increase the intra-abdominal pressure in order to throw away the object that is obstructing the airway. We are going to check a video now about that. Please pay attention.
It can happen in an instant. 1 minute there's friendly conversation around the table, the next minute someone's choking.
Are you okay?
According to the National Safety Council, roughly 5,000 people die from choking each year. Josh Mockley, a Mayo Clinic cardiac nurse, says when you see someone choking, it's important to remain calm as you let them know you're about to help.
So you want to place the thumb side of your fist against the person's abdomen, and then you want to apply the other hand on top of that, and then sharply apply pressure to relieve the air.
It's called the Heimlich maneuver.
1, 2, 3.
Mockley says to repeat the process until you see the object they're choking on come out of the person's mouth.
1, 2, 3. Are you okay?
Oh, yeah, thank you so much.
Yeah, you're welcome. Glad you feel better.
If the person loses consciousness before the object comes out, make sure someone calls 911 for help while you continue to work to clear the person's airway.
1, 2.
For the Mayo Clinic News Network, I'm Ian Roth.
So the Heimlich maneuver, it's a maneuver that it was very explained there. And it's very important to know because you can save lives in any moment, in any place. Most of the time it can occur in restaurants. So it's very important to know it. I invite you, if you have doubts about the technique or anything, you can search in YouTube. Also, you can ask me. And if I don't know, maybe we can search together more things. Now the little potatoes, like the take-home message of this class is that it is a must to know the basic life support. It's very important and are very simple skills. The immediate recognition of a cardiorespiratory arrest and the activation of the emergency response system is the minimum. We need to do that and in the correct time. And the recognition is a very important challenge because sometimes you can feel that is a patient that is, I don't know, she's alcoholic and is in the street, or maybe he's stoned or anything, he's sleeping, but it's preferable to go there and assess the pulse and maybe pass a moment of a shame because you wake up the person, or maybe you have a very uncomfortable moment. I prefer for you to pass that shame, or for me, than step away and only walk and see that and say to ourselves that anything is happening and go away. Maybe that patient can have been saved. So it's important that the immediate recognition is the key here, to start early, because every minute that passes after a cardiac arrest is a minute that is you're losing neurons in your brain, you're losing your heart, and you're losing your life. Early and high quality CPR save lives, and the rapid defibrillation also save lives. So thank you very much. I hope you enjoyed the class. I encourage you to answer the survey about the quality of these seminars, and in order to try to improve the classes to make better explanation and everything. The survey, you can find it in the WhatsApp group. It's a link of SurveyMonkey link. So there you press the link and you can share your opinion with us. See you the next Thursday.